All right, we are live. Good morning, good afternoon, good evening, depending on where and when you are watching this Facebook Live. This is the voice and the face of Dr. Olabintan, CEO and founder of Livingspring Family Medical Center here in the good city of Mansfield, Texas. I am excited to be here again to be discussing another live. And the topic today is Doc, I'm pre-diabetic. What does that mean? Because I'm scared of diabetes. I am
Mhm.
honored to have my friend and colleague, Dr. Leslie Golden, who will be talking with us today. Thank you, Doc, for coming. How are you?
I'm wonderful. Thank you. I'm so glad to be here. I enjoy the videos that you put out for your community, and I'm grateful to be a part of it. So,
Oh,
and this
awesome.
is a topic I can talk about all the time. So, always happy to be here.
Awesome. Thank you so much. Now, for those of you who are watching live, so I can see you and give you a shout out, hashtag live. For those in replay, hashtag replay. And, of course, I always like to kind of talk about why we have these topics. We have them because we want to improve your quality of life, because we believe that it's not just about living long, but also living well. So let's go ahead. I'm going to ask you, Doc, please introduce yourself. Who are you and what do you do?
Sure. So, I'm Dr. Leslie Golden. I am a family medicine and obesity medicine physician in Watertown, Wisconsin, and I have a private practice, and I also have recently developed a weight and gold platform to try to educate people a little bit more about how their lifestyle and their weight may impact their health.
Awesome, awesome. I like what you do. Now the question is, why do you do what you do? Now, particularly, especially the lifestyle medicine. Like, what was it that got you intrigued by that?
Yeah, so it's one of those things I think I was always on that path, but didn't know because before I went to med school, I earned a master's degree in health promotion and disease prevention.
Mhm.
And then, going into primary care, always wanting to have this great relationship with patients, to help them improve their life. And, you know, we get into medicine and it gets busy and hectic and there's policies and algorithms, and I think we get lost in that.
Mm,
And
mm,
I found, at some point I had a patient that we just kept increasing insulin, and we just decided together, hey, there has to be a better way. Let's figure this out. And as I went through that transformation with her, as I was learning to figure out how to help her, because honestly, in medicine, they don't really teach us as much to focus on lifestyle. I mean, they do, they tell us to, but not really how to do it, and they definitely don't teach us how to deal with weight. So I had to learn a lot about that, and as I helped her transform her life, I also transformed mine and
wow.
found how that improvement in lifestyle and wellness impacted me. And I just couldn't help but continue to share it. And for the first time in a long time, I felt like I was really making a difference in patients' lives rather than just like putting a band aid on something. So,
Awesome. Awesome.
mhm,
And I'll say this that, for those of you who are watching, find you a doctor, even if it's not us, find you a doctor who's willing to learn
mhm,
ways outside of conventional medicine or outside of typical medications to improve your quality of life. Because when we empower you that way, the
mhm.
effects are almost transgenerational. Like it's not, it actually outlives you. So
It
very,
is.
very important.
I always try to tell patients, like, I may see you only once or twice a year. You're with yourself every day. The best thing I could do for you is take the time to teach you how to manage this when I'm not around.
That is key. Thank you
Mhm.
for what you do. Now, let's go right into it. What is pre-diabetic? So I'm the patient asking, God, what is pre-diabetic? What does that mean?
Yeah.
Mhm.
I think the biggest message I want to make sure people understand is the pre-diabetes stage is not a stage of relief, right? When I see so many patients, we come in, we screen for diabetes. So But diabetes is a process. We don't just all of a sudden end up with type 2 diabetes. We're talking about the insulin resistant type, not the autoimmune type 1 diabetes type where antibodies attack the pancreas. So we've known for a long time in medicine, and we're trained that when someone is diagnosed with type 2 diabetes, they are more than likely to have some type of complication from it already at time of diagnosis. And like, why is that? And a lot of patients don't realize that that process has been building for a long time, likely decades. So we developed this way of trying to identify people that are at risk of developing diabetes. So we have an opportunity to make that change, to prevent that and change that for them, um, for the better. So hopefully they don't end up with diabetes, cardiovascular disease, stroke, everything else that comes along with it, right? So as far as defining it, when we go in and get our blood sugar screened or our A1C checked as a part of our risk assessments, diabetes A1C wise is at
Mm.
6.5 or above. And then the blood sugar, if it's fasting blood sugar, we commonly call it, is really glucose, but 126 or above is diabetes. So prediabetes is in this stage before that. So when we're looking at just the hemoglobin A1C, we're talking 5.7 to 6.4. And then that glucose level on fasting, we're talking 100 to 125. So just right below there. Um, and I see a lot when people get this diagnosis, or even providers in general will kind of take this phase of like, oh, you don't have diabetes, exercise, and we'll recheck next year. And you'll hear patients kind of say, oh, I'm borderline, or things like that. But
Mm.
I always want to encourage patients that there's a sense of urgency to this state, because I've seen it where people didn't realize how serious this was, and 3 months later, they're now A1C 8
Mm.
and uncontrolled diabetic or having diabetes. So prediabetes in itself is a serious condition that already puts you at risk for heart disease, for stroke, for metabolic disease, for developing diabetes. We shouldn't be waiting till we have diabetes to do
Mm.
something about it.
Mm. That is key. Almost, I mean, think of
Mhm,
it like catching a stroke before it happens, or catching a heart attack before
mhm,
it happens, catching diabetes before it actually happens. So it's not something to poo-poo. It's something to take seriously, and make changes so you don't actually jump into diabetes. Now, you
mhm,
kind of alluded to this already in your answer. How close is it to diabetes? Depends on where you are in that range, that number range, and how you follow through, right? But how what would you say to that? Like, doc, how close am I to being diabetic? What would you
mhm.
say to the patient?
Often, I think the numbers that I've seen is every year that someone is in that range, they have a 20% chance of becoming diabetic or having diabetes.
Yeah.
So they, like, within 5 years, if you don't make changes, the likelihood of you developing diabetes is pretty high within that time frame.
Okay. All right. So the point is, when you're in it, try to get out of it. Okay.
Right.
Awesome. So
Right.
now let's talk prevention. Like, okay,
Mhm.
doc, prediabetes. What can I tell people around me or my family members, like, who are saying, can it be prevented? Like, what can I
Mhm.
do to avoid pre-diabetes altogether? What will you say to that?
Sure. A lot of it is going back to those lifestyle factors that we hear all the time, but it's hard to put into practice daily unless we're really motivated, and then we have a why daily to remember, right? But living an active lifestyle, and when a lot of times I feel like we make physical activity and exercise just so much more complicated than it really is. Just it's as simple as moving your body, just finding a way to move your body more. And, we talk about a lot in my field a concept of NEAT, which is non-exercise activity, essentially. So moving more, swinging your arms when you walk, you hear parking in the back of the parking lot so you have further to walk. Go to the grocery store and walk around and do your shopping rather than order it and pick it up, you know. Um,
Okay.
just,
Good
yeah,
dance.
dance would be wonderful, especially for stress control, because then we're handling two things. Um, and nutrition is key. Really trying to avoid those caloric beverages unless you're having them for a treat, maybe from time to time. And really focusing on fresh produce, lean protein, and it being a lot of your quality nutrition throughout the day. And I always like to remind people, we always say fresh produce, and I feel like all my patients go and eat a lot of fruit, right? Because it's so much easier than vegetables. But try to make sure you're eating at least like 3 vegetables a day. Um, for intentional physical activity, yeah, it really just 150 minutes is usually a minimum goal, but wherever you are, don't let that overwhelm you. I always encourage people, hey, wherever you are, increase slowly. First, work on frequency, then build duration, then build intensity. So if you're not exercising now, 5 minutes once or twice a week, fine. Let that become a habit, get used to it, and build. Don't overwhelm yourself because it's hard to maintain that way. So those are a lot of those lifestyle factors. Good, that kind of stress control, adequate sleep. And there are certain medications that we can use, like nowadays, a lot of times it's pretty common to consider using metformin, which is traditionally used in diabetes or PCOS, which is an insulin resistant type state. And metformin can reduce the risk of someone's progression to diabetes. It can reduce the insulin resistance. So if our lifestyle factors aren't working, or if someone's very high risk, so maybe they have a sedentary job, if you have first degree relatives like siblings or parents that have diabetes, if you have high blood pressure, if you may be carrying more weight than is considered healthy, all of those things put you at higher risk. And those lifestyle factors and possibly metformin might be your best bet, rather than waiting until you're diagnosed with diabetes to start the metformin.
Awesome, awesome. So, of course, these are medical suggestions. It's very important for you to see your doctor to
Hmm.
have an individualized plan for you. But I wanted
Right.
to harp on a few things that you said. You said a lot, but number one, you don't want to wait till you're diabetic to do something about it, because at that time, studies have shown that there's actually damage that's already done
Hmm.
to the organ. So you want to catch it before. Lifestyle changes are very, very crucial. We're not just saying this to nag you. It's like,
Right.
oh my goodness, like exercise as medicine, food as medicine, more plants on your plate and in your
Hmm.
mouth. The
Right.
fresher, the better. And exercise, I agree with you, Doc. It sometimes seems daunting. 150 minutes is a long time.
Hmm.
A little 10 minutes here, 5 minutes there, a little spurt of dancing, a little step here and there, all of those actually help minimize the risk. And there are
Hmm.
medications to help as well. Awesome. Now, I have some patients who come in who say, Doc, my doctor always says I'm pre-diabetic. I've been pre-diabetic for me. I think that's just me. What is the risk? Let's talk risk of staying pre-diabetic. What would you say?
Hmm. Well, the risk, we're always worried about that transition to diabetes type 2. And even if you don't transition over to that, even in that insulin resistant state, insulin makes it difficult to regulate your weight. It can cause a lot of other complications. There's studies that show that it increases your risk of cancer. So it's not, we define diabetes and prediabetes by glucose, but it's really an issue of insulin, right? So the insulin levels are getting too high in the body, and insulin throughout the body, it affects nearly every cell in the body. And not usually in this situation in the way we want it to. So the inflammation that can put you at risk for stroke, cardiovascular disease. And there's other conditions that are kind of in the spectrum of pre-diabetes from this insulin resistance. I hate the name of the condition. I wish they would change it, but there's this non-alcoholic fatty liver disease that is quickly becoming one of the leading causes of cirrhosis in our country because of our lifestyles. And it is a part of this spectrum. So we may never get diabetes, but we could be putting ourselves at risk for damaging our liver if we stay in this insulin resistant prediabetes state. And we can put ourselves at risk for high blood pressure because insulin does affect the blood vessels in multiple ways and can increase our high blood pressure, increase our levels of blood pressure to be diagnosed with high blood pressure. So it has a lot of negative impact in our current health, even if we never become someone struggling with diabetes.
All right. Awesome. Awesome. Thank you so much for all
Sure.
this that you shared with us. I hope people who are watching are encouraged. Imagine yourself in your 70s, your 80s, your 90s, however long it is you want to live, still enjoying good quality of life, not having to
Hmm.
sit and listen to multiple doctors tell you what you can and cannot eat
Sure.
because you're healthy, you're
Right.
non-diabetic, you're not
Hmm.
even pre-diabetic. This is why we have these discussions because
Hmm.
your life is worth it. So I hope you're
Yeah.
encouraged. But
Hmm.
doc, I have people who are wondering, who are like, wow, this doc, I like how she explains things. I want to connect with her. Doc, where
Hmm.
can people find you?
Sure. There's two different routes of finding or kind of working with me. If you're looking for just education and lifestyle, the Weight and Gold Wellness platform is on both Facebook and Instagram. I think we're going to post the handles to
Mm,
follow.
yes.
And if you're in the state of Wisconsin and would like to work with me on your metabolic health, um, watertownfamilypractice.com and schedule an appointment, and I'd be happy to work with you.
Awesome, awesome. And what I'll do as always, I will put that information in the comment section for people to connect with you. But this has been very useful. I appreciate
I
you.
agree.
Thank you for those who are watching. I can't see you, but I appreciate you for watching.
Right.
And if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician in the Mansfield or surrounding areas, I am she. Thank you all for watching, and thank you again, Dr. Leslie. I
Of
appreciate
course.
you.
Thank you.
All right. Bye.